So FaceTite is a new radiofrequency technology, which is radiofrequency assisted lipolysis. This is a game changer for people who are complaining of double chins, and in the past Kybella was really their only other option, another non-surgical option. The thing with Kybella is it melts the fat or causes the fat cells to burst open, but it doesn't actually tighten the skin. And that is one of the major differences between that and FaceTite. FaceTite will not only melt the fat, but it also causes the fibroseptal network underneath to contract and the skin itself to contract, and then causes neocollagenesis, which is basically making more collagen and thickening up and tightening the skin. The other important advantage to using FaceTite over something like Kybella, if you're doing that sort of fullness under your chin, is Kybella is usually 2 to 4 treatments, and so you have downtime of 2 to 4 weeks with each one of those treatments, whereas this treatment is a one and done, and your downtime is probably 3 to 5 days of significant swelling, and then the swelling will improve over the next several weeks.
How does FaceTite help with contouring?
So the beauty of FaceTite is that I can actually contour around that lower neck and submental area, and I can do under the chin, I can do along the jawline, I can look after those pesky jowls, I can do fullness down around the neck. And many people as they age sort of lose the definition of their jaw, and with this device I can actually contour around it and melt the fat along the angle of the jaw and give them back that definition. So FaceTite is an amazing non-surgical option for people that are not quite ready for a facelift or do not want to have a facelift and don't want to have any scars done. And really, I can do people as young as in their early 20s if they're going for their selfie chin, all the way up into their sort of mid to late 60s, depending upon the amount of contouring they would like. The amazing thing about using FaceTite is that it is essentially pain-free. I will use tumescent anesthesia, which is basically just using saline and putting in your lidocaine and your epi and your bicarb into it, and I will infiltrate the entire area where I'm treating, and then it's absolutely completely numb. And then on top of that, they can use the Pronox or the laughing gas, and many of my patients will actually fall asleep while I'm doing the procedure. One of the questions I get asked an awful lot of is, what's the downtime? And the downtime is actually not bad, usually about 3 to 5 days. So typically I'll do it on a Thursday or Friday afternoon, and the patient's able to go back to work on the Monday. We have been getting a lot of positive feedback about the FaceTite procedures. People have been absolutely ecstatic with the results. They'll start to see results immediately afterwards, and that we have melted the fat, and I've usually lipoed it out, and they'll see that they've started to have an improvement in that sort of that double chin area that they've got. As the swelling goes down, they get more and more definition around their jawline, and then with the neocollagenesis that's going on, they'll get tightening of that skin over the next 3, 6, 9 months. And what I say to them is like the gift that keeps on giving. They come back for their 1 week follow-up and they're happy. They come back at 3 months, they're ecstatic. They come back at 6 months and they're over the moon. I think it's really important that people feel confident in their provider and their ability to perform these very complex procedures. Rest assured, as an MD, I will be the only one that is performing this procedure, but not only that, I'm actually the physician trainer for the FaceTite device, and I fly all over the Western states teaching other physicians how to effectively and safely use the FaceTite device. Hi, I'm Dr. Nicolle Kent, Medical Director at Tranquil Waters Med Spa and Physician Trainer with Inmode. Come visit us at Tranquil Waters Med Spa to have a private consultation with an MD that you can trust.